60 to 100?
Maybe could be
Has
felt
nothing to do with the
easily.
rate. You can hear it in an even tone sound, okay? What is regular? Consistent beat, okay? So when you guys start checking you guys each other's pulses, assess to determine whether or not they have a regular or irregular pulse. What would an irregular pulse be?
It's not consistent.
It's not consistent. I tend to have an irregular pulse rate. It'll sound like boom, 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 boom,
Like
boom,
sound
boom, boom, like the beat of a drum. So assess it amongst each other.
Would that be considered strong as well?
It would be strong because you're getting a strong sound, but it would be irregular because you're not getting a consistent nothing. Okay, bless you. Any questions?
What do you mean again by bilateral pulses? It just means it's on the arm and the leg.
Two. Bi means
Both
two.
sides. Okay.
Yes. If a patient is sleeping, same thing? If your patient's sleeping and you just want to get a pulse,
Right here.
but you do want to wake them up. Can you imagine you just had this comfortable sleeping, you're dreaming you're on the beach, and you see like a shark, and then it's just coming closer and closer and closer and closer, and someone just goes like this? What are you going to do? I'm going to do this. So you don't want to do that. You want to at least kind of nudge your patient and say, hi, this is Francis. I just need to check your pulse rate real quick. If it's an unconscious patient, don't worry about it because you're not going to have unconscious patients. But if you are going to have a patient in the future and you're the nurse, you can check it anywhere. It depends on the situation. If you know that this is an unconscious patient and you know the circumstances, it's still fine to check a radio, but I'm sure you probably would have assessed that there's still pulses bilaterally all over the extremities, okay? If your patient is coming in like they commonly come in through me in a a cardiac emergency, and we are not sure if there's a pulse or they're doing CPR, then I'm going for the carotid or the femoral. Because
what you just said, when you're coming on shift, always, unless the patient's comatose, wake the patient up. That's part of your neurological exam. And I'll tell you, this happened years ago. It wasn't on me, but the patient, the night nurse said, oh, the patient slept well, the patient did fine. Well, the day nurse comes on, the patient stroked out, the patient never woke up. The night nurse went home, so that's on you. You need to make sure that, especially something like that, you go on to the night nurse and see if the patient's okay, if you're suspecting any kind of neurological issue with the patient. But just CYA, because that will be on you.
yeah, you always want to make sure that your patient is awake, can wake up, okay? That's part of your multi-system type assessment when you're walking into the room, and you guys will start developing those skills. When you're walking into the room, like she was saying, you're having your good morning, hi, my name is, I'm just going to check your pulse really quickly. You start asking your questions, you see their orientation. Once you start having those kind of practices, you'll get 5 things done in 2 minutes. You have your orientation, you have your vital signs, and you have their patient status. Okay? Any questions on this? Yes. Back.
Would you mind elucidating once more on the strong pulse is one that is visible and the regular?
No, it's not visible. A strong pulse is something that's audible.
It's what?
Audible. You can hear it strong. You can hear a consistent beat.
With stethoscope.
No. When you're palpating it. It's not something you're going to see.
Got it.
Does that make sense?
Yeah.
So when you feel it, you're going to feel a consistent, strong pulse. If you're trying to feel someone's pulse and you can hardly feel anything, and it takes a lot of effort and concentration, and you barely feel a faint, That's not a strong pulse. And a question in the front?
Does the age of the patient,
Determine the rate?
Yes.
Yes.
Determine also, whether you wanna check the pulse? Like, if a baby versus an old.
Yes. And I'm gonna leave it there. Last question.
Some patients who are overweight, does it affect where you would take the blood?
Yes. So certain locations you may have a harder time palpating depending on the amount of adipose tissue, but you will still go for your basic and then work your way around to the more complex. Okay. So you guys ready to check each other's heart rate?
Yeah.
Do you know how often you need to check it for? What's your time frame to count your beat?
60 seconds.
60
Or 30
seconds, right?
seconds.
So you're counting for 60 seconds for the heart rate. 60 seconds.
Exactly, but, you know, make sure you got your math in order.
60
You need a
seconds.
stopwatch.
Are you guys ready? So you're gonna